Well, it's a condition that impairs the lymphatic system and can cause severe swelling and other painful symptoms.
Although there is no known cure, lymphedema is treatable. And Rithe Pal of Doctors Community Hospital is joining us now with more on this issue.
Thank you so much for joining us.
Thank you for having me.
A little bit about what this is.
Lymphedema is a chronic swelling, as you said. It's swelling. Usually the swelling occurs in the lymphatic system, which manifests in arms or legs, and you get a chronic swelling. Lymphedema is treatable. It's not, you can't cure it, but it's treatable.
So tell us, what causes it actually?
Lymphedema can be caused by several things. One, you can have a hereditary system that governs you to have lymphedema. Two, you can have secondary issues like injuries, surgeries that impairs the lymphatic system and the flow of the lymphatic system, which can manifest itself in swelling, as we said. Usually arms, legs, but the swelling can occur anywhere in the body where the lymphatic system is impaired.
Is it usually a hereditary condition?
No, that's called primary. It can be primary or secondary, secondary from injury or surgery.
Now, who typically gets this? Is it most common in men, women? Is there a particular ethnic group that gets it?
No, actually it isn't, and that's what's the unique thing about lymphedema. It crosses ethnicities, and it also it doesn't govern. It's not governed by gender.
Mm-hmm. What about age?
No. Okay. Absolutely not, because you can be born with a impaired lymphatic system from birth, and then you kind of don't see the symptoms until later on in life, because the lymphatic system continues to work and tries to handle the impairment, and eventually you'll get what's called lymphedema, which is the chronic swelling in the arms or leg.
And I actually have a couple family members that have this, where suddenly, sometimes it might be stress or something that activates it, but the hand will start to swell, and it doesn't happen often. Are there stages to this? Are there certain things that happen before the swelling starts?
Yeah, the first stage is a latency stage, where you will get swelling maybe, say, a month or so, and then the swelling would go away with elevation. Swelling starts distally, which is in the hands or in the feet. Then you kind of notice that it progresses over a period of time, and eventually when lymphedema gets to stage 2 and 3, elevation doesn't work, or any other techniques except for therapeutic approaches.
Talk about treatments. What can be done about this?
It's several things that you can do for lymphedema, but some of the main treatments are massages, which is called manual lymph drainage, which is a light massage that's performed on the patient, and what you're trying to do is to push the lymphatic fluid away from the involved side so that the body can handle the lymphatic fluid, and it winds up in the digestive system.
All right, and is there anything that people can do if they think that they have this? Is there any place they can go and get
consult their
some
doctor first, and the doctor usually does a history to determine whether or not he or she thinks that it's lymphedema. Blood tests can monitor or can determine your lymph percentage.
All right.
Thank you so much,
information.
Dr. Pal.
Thank you. And for more information about the condition, you can call Doctors Community Hospital's Lymphedema Center. That number is 240-965-8410.